Now we already have discussed about the trigeminal nerve, which giving three branches, that is ophthalmic division, the maxillary nerve division, and the mandibular nerve division, in which we are going to discuss today about the mandibular nerve division. Already one video has been uploaded about the mandibular nerve division, that is buccal nerve branch and the meningeal nerve branch. These all were discussed with you people about the how the buccal nerve course downward and supplies the different area, and these are the summary of something which are being supplied by the mandibular nerve division. Okay, now coming to the posterior division. This buccal nerve division is the anterior branch of the this buccal nerve division is the anterior branch of mandibular nerve division. So now we are going to discuss about the posterior division of the mandibular nerve. So along the posterior division of the mandibular nerve, we give three branches, which is the posterior division of the mandibular nerve. It is one of the longest branch of the mandibular nerve. Okay, now it contains of motor component and the sensory component. The motor component of the posterior division of the mandibular nerve is the more important and is the longest division. Okay, now the posterior division of the mandibular nerve will descend downward medial to the lateral pterygoid muscle. This is already discussed that the nerve buccal nerve was medial to the lateral pterygoid muscle, and the posterior branch of the mandibular nerve is medial to the lateral pterygoid muscle. Then a viva question can arise here, that what is the relation between the medial pterygoid muscle and the mandibular nerve posterior branch. Then we will have to answer about that कि mandibular nerve is the division which is medial to the medial pterygoid muscle. Okay, to the lateral pterygoid muscle, and it will descend downward, giving its three branches. In the posterior side, it will give a branch that is called as auriculotemporal branch. Auriculotemporal branch, the lingual nerve branch, and the inferior alveolar nerve branch. Okay, inferior alveolar nerve. These are the three divisions of the mandibular posterior nerve. Okay, posterior division of the mandibular nerve, three branches. Now let's discuss about every one by one. The first one is the auriculotemporal, second one is the lingual nerve division, and the third one is the inferior alveolar nerve division. So come to discuss about first the auriculotemporal nerve. So the auriculotemporal nerve will transverse downward. Okay, will transverse downward into the upper parotid gland. Let's see, this is the upper part of the parotid gland. And the auriculotemporal nerve will transverse into the parotid gland, and it will cross. How it will reach the parotid gland? By crossing the zygomatic arch of the posterior portion of the zygomatic arch. The which branch will be supplying the parotid gland? The sensory branch will be supplying the parotid gland, that already been discussed with you. Now there are many fibers from the auriculotemporal nerve, ATN, parotid gland, PG. So it will, as already discussed, that the auriculotemporal nerve will transverse into the parotid gland by crossing the posterior portion of the zygomatic arch. This will be the sensory innervation. to the parotid gland. There are many fibers that communicate with the facial nerve branch. The auriculotemporal nerve fibers communicate with the facial nerve branch, and they provide the sensory innervation to all those areas in which the facial nerve branch is supplying the motor innervation. Means what? Those areas where the facial nerve is supplying its motor branch, motor division, in those areas the auriculotemporal nerve go and supply the sensory division. So the sensory division will be supplied by the auriculotemporal nerve. Those areas are zygomatic area, the buccal branch area, and the mandibular nerve area. Means the facial nerve has branches, zygomatic, buccal, and the mandibular, and there are two other branches. So those nerves supply the motor component or motor innervation. Then the auriculotemporal nerve will go and supply to the skin over the area of those innervation. Now it also communicate with a ganglion. Already discussed that trigeminal nerve supply all the four parasympathetic ganglion. So it will also supply the otic ganglion with his sensory innervation. They will also give a sensory innervation, secretory innervation to the parotid gland. Now it will the auriculotemporal nerve will give a branch. The auriculotemporal nerve will give a branch okay. The auriculotemporal nerve will give a branch that will be called anterior auricular branch. This anterior auricular branch will go and supply the tragus of ear, will form a helix or the skin over the helix and the tragus of ear. Okay, so it will supply the helix, skin over the helix and tragus of ear. Now the most important component, that is auriculotemporal, having the external auditory meatus, that is auditory branch. The auditory branch will supply the area between the meatus and the tympanic membrane. The articular branch will supply the articular branch will supply the TMJ. The superficial temporal branch, there will be a superficial temporal branch, and this branch, superficial temporal branch, will supply skin over the temporal region. So once we will revise whole about the auriculotemporal nerve. From starting, we have already discussed everything that the auriculotemporal nerve is a branch of posterior division of the mandibular nerve, which gives transverse secretory motor fibers to the parotid gland by crossing over the posterior of the zygomatic arch. Now it will run downward, supplying its one sensory innervation to the otic ganglion and give a branch. It will give a run downward again and will give a branch to the anterior auricular nerve. The anterior auricular nerve will supply the skin over the helix and the skin over the helix, that is tragus of ear. The another branch will be given by it, which will be the articular branch, and which will supply the TMJ, and then our external auditory branch, which will supply the skin over the auditory meatus, and superior temporal branch, which will supply the skin over the temporal bone or the temporal region. Now come to the very important, that is the lingual nerve branch. the lingual nerve branch, which is one of the most important branch of the posterior division of the auricular nerve, posterior division of the mandibular nerve. It will run downward, passing through the what mandibular nerve posterior division was. It will run medial to the lateral pterygoid. ये सबके लिए अप्लाई होगा. Now the lingual nerve will run medial to the lateral pterygoid muscle, and will descend downward anterior and medial to the inferior alveolar nerve. Okay, then it will descend downward and lies between the it will descend downward and will lie between the ramus of mandible and the medial pterygoid muscle. मीन्स व्हाट कि मीडियल टेरिगॉइड मसल के तो मीडियल साइड में, लेटरल टेरिगॉइड मसल के तो मीडियल साइड में था ही. अब क्या कर रहा है कि जो मीडियल टेरिगॉइड मसल है वह आकर के लाई करेगी कहाँ पे, रैमस ऑफ मैंडिबल पे. तो बिटवीन द रैमस ऑफ मैंडिबल एंड द मीडियल टेरिगॉइड के बीच में यह लाई करेगा, टू इन द टेरिगो मैंडिबुलर स्पेस में. ओके, नाउ इट विल रन anterior to the inferior alveolar nerve, medial to the inferior alveolar nerve. Okay, it will continue to run downward. Okay, it will continue to run downward and will enter through the pterygomandibular raphe, run downward and will pass through the pterygomandibular raphe and below the attachment of the superior constrictor of the pharynx. Below the attachment of superior constrictor of the pharynx, मतलब superior constrictor जो pharynx का है उसके below में, मतलब run करेगा and reach करेगा दूसरे side में and will supply one of the most important part, that is anterior 2/3 of the tongue. 2/3 of the tongue को supply करेगा, anterior 2/3 of the tongue को सप्लाई करेगा बिहाइंड द मैंडिबुलर थर्ड मोलर. इट लाइज जस्ट बिलो द म्यूकस मेम्ब्रेन इन द लेटरल लिंगुअल सल्कस. और यह लाई कहाँ करेगा, जस्ट बिलो द म्यूकस मेम्ब्रेन, लेटरल लिंगुअल सल्कस बना हुआ है वहाँ पे यह लाई कर जाएगा. नाउ प्रोसीड करेगा एंटीरियरली एंड क्रॉस करेगा द मसल्स ऑफ द टंग एंड वहीं पे लूप बनाएगा और यह सप्लाई कर देगा, दैट इज सब मैंडिबुलर ग्लैंड को, सब लिंगुअल ग्लैंड को एंड अपना एक टर्मिनल ब्रांच के थ्रू सप्लाई कर देगा. मतलब लिंगुअल नर्व क्या किया, दैट मीन्स द लिंगुअल नर्व विल सप्लाई रन डाउनवर्ड फॉरवर्ड इनटू द टेरिगोमैंडिबुलर raphe, crossing the superior constrictor muscle of the pharynx to reach the other side of the tongue by supplying through the 2/3 of the tongue and reach into the submandibular space by running downward and into the lateral sulcus, then lateral lingual sulcus, and then it will run by making a wired loop over the submandibular submandibular duct. Now to the deep of the sublingual gland, it gives a terminal branches and gives into the terminal branches. Now it will over the on the tongue the sensory supply will be given. So the gustatory function, ठीक है, the sensory supply will be given. So the gustatory function, so what are the supplies from the we have discussed, that is submandibular gland, sublingual gland, anterior 2/3 of the tongue, anterior 2/3 of the tongue, and behind the third molar, that is buccal and mucous membrane and all the gustatory. This nerve fiber also along with the chorda tympani is supplying them. and the lingual nerve also provides sensory innervation since they are running into the lateral sulcus, so the floor of mouth, gingiva, and lingual aspect of mandible and lingual aspect of gingiva and lingual aspect of mandible means, let me think that it is mandible. Now all the things are being covered, and now come to the inferior alveolar nerve block. Now the inferior alveolar nerve, one of the most important nerve that supplies the tooth anatomy, and in the dentistry, inferior alveolar nerve is of one of the most important aspect. Now the inferior alveolar nerve block will descend downward, posterior and lateral to the lingual nerve, okay, and in the region between the mandibular ligament and the medial aspect of the mandibular ramus. मतलब in the region between the mandibular ligament and the ramus of mandible and medial aspect of ramus of mandible, accompanied by the different artery, alveolar artery and the alveolar nerve, and alveolar artery and the alveolar nerve enters into the mandibular canal. Now the nerve enters into the mandibular canal and gives off its branches, enters into the mandibular canal and enters the mental foramen, where it divides into the two branches, in which the mental nerve branch and the incisive nerve branch. The incisive nerve branch is the continuity of the mandibular inferior alveolar nerve branch into the mental foramen, and the mental nerve branch is coming out of the exit the canal through the mental foramen. mandibular canal को exit करता है and mental foramen के through and innervate the skin of the chin, that is the mental protuberance, mucous membrane of the lower lip, and lower lip को now कौन सप्लाई करता है. अब एक क्लियर हो गया, that is यह दो पार्ट में डिवाइड हो गया हमारा, that is incisive nerve and the mental nerve, okay, incisive nerve और mental nerve, और एक हो गया that is myelohyde nerve. तो माइलोहाइड नर्व के बारे में भी बात नहीं कर रहे हैं, माइलोहाइड नर्व के बारे में बात करेंगे. द इंसाइसिव नर्व जो होती है कंटिन्यूटी होती है हमारी मैंडिबुलर नर्व की, और इट विल सप्लाई द कैनाइन इंसाइजर्स प्रीमोलर एरिया with its dental plexus branches within the mental foramen. Now the mandibular nerve mental nerve exit the canal through the mental foramen, will supply chin or mental protuberance skin. Now come to the myelohyde. The myelohyde nerve is one of the most important nerve. The myelohyde nerve is the part of inferior alveolar nerve which, before the entry into the mandibular canal, they run downward and forward, and will enter into the myelohyde groove and supply the myelohyde muscle, and supply the myelohyde groove on the medial surface of the ramus along the border of the mandible, to reach the myelohyde muscle. It is a mixed nerve, and being motor to the myelohyde supply the anterior belly of digastric, and also supply the anterior belly of digastric and the myelohyde nerve. So all these, the motor component will supply the myelohyde and the anterior belly of digastric. Already two nerve tensor, and all the four muscles of mastication, sensory supply to the skin and the mental protuberance also, and supply the mandibular incisors, and supply sensory supply to the mandibular incisors also. The mandibular fiber मोलर को पल्पल ब्रांच इनर्वेशन देती है, and once the inferior nerve enters the mandibular canal along with the anterior and along with the artery and vein and will supply all the division. तो इस तरीके से हमारा complete होता है, that is mandibular nerve. Okay, that's all. Thank you. Keep watching, keep loving, and do like, share and subscribe my YouTube channel Pharmacology Adda.